Today we're going to show you how to do the male insertion, but before we do, I'd like to show you the setup for the male so that every time you do this you're consistent in your setup. We have sterile gloves versus the female procedure where you saw non-sterile gloves. Everything on this tray except for the Steri-Strip and the benzoin is sterile. We have an 11 blade just like we did in the female. We will draw up our lidocaine and bicarb sterilely. We have a Ducal semi-permeable membrane, which I did show you in didactic, and then a sterile tray with the trocar pickups. And the pellets have already been dropped. All of the male pellets have been dropped, and then sterile gauze. With that being said, let's begin the male insertion technique. Now we're going to continue the male insertion technique, but before we get started, I'd like to introduce Mandy Donovitz-Cotton, nurse practitioner who will actually be performing the procedure for you today. And before we start, we'd like to get the proper position on the patient because otherwise it makes the insertion a lot more difficult. Most guys typically rotate their leg this way when they sleep, and that's going to internally rotate the hip. We don't want that. We like the bottom leg bent and the top leg straight. That's a much better position for insertion of the pellets subcutaneously. We'd like to now find out where do we want the pellets to go and then where is the incision going to go. Then we'll prepare the patient with ChloraPrep. So the pellets, we really would like them to go out here in the soft spot. If you get out too far lateral in the IT band, those pellets are going to cause a lot of discomfort. So out here in the soft spot is where Mandy wants to have the pellets, and her incision should go about 3 finger breadths from the top of the crease. If you'll do it 3 finger breadths from the top of the crease, you won't be too lateral and the pellets will land where they're supposed to. Having said that, now Mandy's going to put on some sterile gloves, not clean gloves like we used in the female technique, and I'll give her some ChloraPrep in a sterile fashion so that she can prep the entire area. We don't use betadine because betadine, especially under a dressing, can lead to blisters, and those blisters actually hurt worse than the procedure and take longer to heal. So with the ChloraPrep, she'll start back where her incision is going to be, and in a circular fashion, she'll prepare the entire area with the ChloraPrep. Once the area is prepared with ChloraPrep, the next thing is to get our lidocaine and bicarb. We'll be using today lidocaine with epinephrine, and you should use about 10 cc's for the male. And Mandy has an 18 gauge needle to draw up the lidocaine, and she'll draw 10 cc's of the lidocaine. We'll follow that with sodium bicarb 2 cc's. The sodium bicarb will actually buffer the lidocaine, which actually makes the lidocaine burn less. Then Mandy's going to switch to a 22 or 23 gauge needle. That really seems to work the best. And she needs to make her wheel because the wheel is the most important thing, at least for the incision. And she's also going to create a triangle. That triangle is going to extend from her incision out laterally, so there's a triangle where the pellets are going to go. So her first thing is to form the wheel. I'd like it to be about the size of a dime, and then she's going to keep pushing the lidocaine all the way into the hub, and then drive the hub, delivering another 1 or 2 cc's. She's then going to pull back and make a second track of this triangle, and we're actually going to do 3, and she'll be inserting lidocaine with bicarb, and then she'll do it a third time. Once that's done, you can see that she has a nice triangle covering the entire area where the pellets are going to go. Now the patient's been prepared, he has now been anesthetized, and to let that lidocaine set up, we'll take some time to build our trocar. Here's our trocar with its sharp plunger. That plunger will fit perfectly in there and lock. If you'll keep your trocars together, they're married for life, they won't get mixed up and they should always work. These are milled trocars and they're not interchangeable at all. Now, once we've done that, she's going to take her 11 blade. We need about 1.5 blades for this 4 millimeter trocar. So she'll make her incision in the middle of her wheel and then about 1/2 of a little additional incision, and that should be adequate for the incision for the trocar. You don't want to have your incision too small where the trocar won't go in or you're having to put too much pressure. That could lead to problems, as I showed you in didactic. Once she's done that, she can take her trocar, and what we want to do is take the angled bevel straight up and down 90 degrees to the skin and bury the bevel. Once that bevel is buried, she'll lay back her trocar, and with a twisting motion and counter traction on the skin, she just twists the trocar in to the end of the bevel, and once it's all the way in, she'll remove that sharp trocar, leaving the basket on top. The reason is we need to put those pellets in. If the basket is angled, the pellets are going to fall out. So next thing we'd like to do is get our forceps. We use this tray to catch any pellets that don't make it into the basket so they would remain sterile. So we're going to take the first pellet and we're going to put it into the basket, push it into the trocar. We want everything to stay in this basket. Then we'll take the blunt probe, not the sharp one, put it into the trocar. We're going to turn our trocar to the 9 o'clock position and she will insert the first pellet. Stabilizing the front and just pushing with her thumb, the pellet goes in nice and easy. We then turn the basket back to the 12 o'clock position, inserting the second pellet. Again, having the basket underneath really works the best. Blunt trocar again, inserting. This time we're going to go to the 12 o'clock position. The trocar should be at 30 degrees to the skin. She's now inserted the second pellet. And now she's put her forceps back in the basket, ready for the third pellet. And we're actually going to put 4 pellets in each deployment. So this is the first deployment, this is the third pellet, and now she's going to turn, after she inserts it, to the 3 o'clock position, stabilize the front of the trocar, and push with her thumb. Now she has the third pellet in. And now we're going to put the fourth pellet in at the 6 o'clock position. Before we turn the trocar, we must insert it at the 12, and then we rotate it to the 6 after we put the blunt trocar in. So now we've put 4 pellets in, painlessly into the patient. And now what we want to do is move the trocar basically a ½ a centimeter to the side. And to do that, she's going to insert the sharp trocar again, pull back a ½ a centimeter, and then move the trocar just a little bit lateral to get around that first round of pellets. And she's going to do the exact same thing. Insert a pellet, turn it to the 9 o'clock position. After she inserts the pellet, put that pellet in, deploy that pellet, and then put the second deployment at the 12 o'clock position, and we're going to turn the trocar to the 12 o'clock where it already is, insert the second pellet. Third pellet will go in now at the 3 o'clock position, exactly the same as we did the first time. So she'll put the plunger in, rotate to the 3 o'clock position, and insert. One more at this deployment. We'll insert the pellet at the 12 o'clock position, put the trocar in, and then rotate to the 6 o'clock position. We've now put 8 pellets in. He is only getting 8 pellets, and so we are now done, and everything will come out together. So Mandy has now completed 8 pellets and 2 deployments. That's all this patient's going to get. If he was going to get more pellets, we'd simply deploy the trocar a third time, a ½ a centimeter back, and then just a little bit lateral. The nice thing is he's already numbed up for that. And so we always do 3 deployments with the lidocaine. That way, if you encounter scar tissue or if for some reason you find out you have more pellets to put in and you couldn't put them in that second deployment, you're already numbed up. And that's a great pearl for you guys on the go forward. So now what we have to do is close the incision. So we'll use benzoin. You don't need a lot of benzoin, just 1 stripe on each side of the incision. That's it. That's just to keep the steri-strip in place, which is very important in the male. So we'll take the steri-strip next. She'll put it on one side of the incision, and then with traction, bring the edges together and set it to the other side. So now the incision is closed. You don't need Dermabond. You can use it if you want. You don't need stitches. Now she's going to take a 4x4, and we have a Ducal semi-permeable membrane that I showed you in didactic. We'll cover that in exactly a crossing manner, not in the same direction as the trocar, but across that steri-strip. Once that semi-permeable membrane is in place, the outer paper comes off. Mandy's going to put some pressure for 2 or 3 minutes there, which keeps any blood or effluent from the lidocaine from running out and then making a bubble up underneath the steri-strip. We're also going to give the patient some instructions. We'd like them to know that for the next week in the male, not 3 days like the female, no baths, no soaking in a swimming pool or hot tub, no elliptical, no biking, no squats, nothing that's going to work the glutes, because what we want to do is actually let those pellets set up in there quietly. That will reduce the extrusions that you get. If you allow your patient to exercise right after pellet insertion, their extrusions are going to be higher, their infection rate is going to be higher. So once we have the dressing all done and the instructions done, we're actually going to take an ice pack and you wrap it with a piece of gauze, and we'll put the ice out over where the pellets are. What that does is reduce any bruising and swelling. We'll have the patient actually take that ice pack off in an hour or so. It'll be thawed out. They can refreeze it and reapply. So we have the ice pack on for twice in the same day. And then 1 week from now, he'll take the whole dressing off. If he'll do that, that cuts down again his infections and his extrusions, and that's the male insertion.